My name is Mark Webb. I'm a consultant orthopedic surgeon who specialises in sports, hip and knee injuries and also in major trauma. I don't think that it's a choice between autograft or allograft. I think the choice is about making the correct decision for the patient. So in instances where I'm doing revision surgery for, say, an ACL revision, part of the procedure is that we need to put bone graft into the tunnels. Previously, this could be harvested from the iliac crest of a patient, but we know that patients find that really painful and it risks second site surgery problems such as infection, scars, and ongoing pain. So in those circumstances, using an allograft is more favourable to the patient. With the tissue that's available through hospital innovations, you can specify your exact parameters of what you need. So for instance, when performing ACL revision reconstruction and when you're needing to apply bone graft into the tunnels, you can either use bone dowels that are sized specifically for that case, or something like PlyFX, which is moldable and you can fill the defect as required. So I recently had a patient who had an infected ACL reconstruction who came to see me for their definitive management. When removing the graft and the infected bone, we were then left with a defect, and that defect needed to be filled with a bone graft. So when treating bone infection, the principles are that you have to fill the void, which PlyFX is able to do as it's fully moldable, with the additional benefit that I could add the antibiotics of my choice as part of the rehydration process so that we can deliver high-dose antibiotics locally to treat the bone infection. So when I think about using a new product or a new product introduced to me, the first thing is it has to be safe. So it has to be safe for the patient and it has to also be safe for the surgeon and the theatre staff. If you're considering using allograft, I think it's important to understand what you're using, where it's come from and how it's prepared. There are modern techniques to sterilize the tissue that's being used, which doesn't affect the tissue quality or its tensile strength. I would recommend, if you are going to start using allograft, that you understand where it's come from and how it's prepared to ensure that you're providing the best quality product for your patients.